Hello, everybody. My name is Fabiola Malordi-Xun. My qualitative research proposal is on understanding factors influencing nurse retention among new graduate nurses in the medical surgical unit. So Med-Surg is a diverse and dynamic specialty that is the backbone of healthcare. Med-Surg nurses care for a diverse adult patient population and treat a wide range of medical conditions. It is one of the fastest growing specialties due to its aging population and rising healthcare demands. However, the current challenge faced now are the declining retention rates among new med-surg nurses, with nearly one-third of new grads leaving within their first year. The average cost to replace a bedside nurse is about $4,600. This leads to increased hospital expenses, worsens the staffing shortages, and reduces institutional stability. This ultimately leads to a decline in patient care quality and staff morale. The declarative statement is high turnover rates among new graduate nurses in medical surgical units presents a significant challenge to healthcare as it exacerbates the nursing shortage, drives up institutional costs, and compromises the quality of patient care. So I have a particular interest in this study because I have 4 years of experience as a med-surg nurse, and I currently work in a high acuity telemetry and post-cardiac procedural floor. I'm also a nurse preceptor and charge relief. So I have witnessed firsthand the impact of transitioning from a role of student nurse to clinical nurse, and how the high acuity and turnover among new graduate nurses really affects our team dynamics, workload, and compromises patient care outcomes. So with seeing this, I have a deep commitment to improving workplace conditions and fostering a supportive environment where new nurses can thrive. So through the review of literature, I identified several studies that show specific factors that influence new graduate nurse turnover. This included burnout, unsafe staffing, job stress, verbal workplace violence from patients and healthcare professionals, and poor nurse-to-physician relationships and inadequate peer and nurse management support. Studies also show that the shift from student nurse to clinical nurse creates a culture shock and presents role transition challenges. So through the literature review, I identified several studies that listed general factors influencing nurse retention. However, there was limited research on turnover intentions specific to med-surg. This matters because med-surg units face unique challenges with high patient acuity and turnover, so addressing retention is crucial for improving patient care, teamwork, and the nursing profession. Turnover intention is defined as a desire to terminate employment at a current hospital or leave the nursing profession completely. New graduate nurse is defined as a nurse with 0 to 2 years of clinical experience post-graduation from an accredited nurse program. For this research study, the definition of the new graduate nurse will be applied for this study. So this problem is significant to nursing because poor staffing levels significantly affect both the quality of patient care and the satisfaction of the nursing staff. The National Council of State Boards of Nursing estimates that over 800,000 nurses plan to leave the profession by 2027. With the position of registered nurses expected to grow 6% annually, the demand for new nurses is expected to reach nearly 2 million by 2031. Also to note, insufficient staffing exacerbates nurse-sensitive indicators such as bloodstream infections, falls, and pressure ulcers, which ultimately leads to negative patient outcomes. While residency programs have been implemented and shown to support nurses during the orientation phases, Many novice nurses still report feeling unsupported and overwhelmed during the transition to clinical practice after the orientation phase. So, by addressing these factors, nursing leaders can create sustainable solutions that not only improve retention rates among new grads, but also enhances overall healthcare outcomes. The population that would benefit most from this study is new graduate nurses. Other populations that would benefit are hospital institutions, Med-Surg units, nursing leadership, and ultimately the patients. The purpose of this qualitative phenomenological study is to explore the lived experiences of new graduate nurses in medical surgical units to understand the factors influencing their turnover intentions within the 2 years of clinical practice. By examining workplace challenges, support systems, and personal perceptions, this study aims to identify actionable insights that can develop strategies to enhance job satisfaction, improve nurse retention, and support the development of a stable and skilled nursing workforce. The research question is, what are the lived experiences of a new graduate nurses with up to 2 years of experience in medical surgical units, and how do these experiences influence their decisions to remain in or leave their positions? This research question for the qualitative design is the variable for the study. It is precise, clear, and it delineates the problem area. This study is researchable because it includes a clear research problem. It is feasible as it can be replicated in future studies. It is relevant and significant to the nursing field, and it includes an appropriate research approach, being qualitative. It also includes data collection, thematic analysis, and again, it has a clear research question. So the research approach that will be used is qualitative, which is a method of inquiry that focuses on exploring and understanding individuals' experiences and behaviors to a specific phenomenon. The aim is to capture rich, detailed insights into the lived experiences of new graduate nurses in Med-Surg and how they impact turnover intent. We hope to uncover themes and patterns to explain this phenomenon. The research design is phenomenological research. This focuses on exploring and understanding individuals' lived experiences of a specific phenomenon through in-depth interviews or personal narratives, in which emphasis is placed on participants' subjective perspectives to gain a deeper understanding of the phenomenon. The population will be 20 new graduate nurses with 0 to 2 years of experience in Med-Surg units, listed below. It will be in a conference room in the chosen tertiary hospital in Long Island, New York. The study will durate from December 2024 to June 2025, and this will allow time for recruitment of participants, scheduling and conducting interviews, and the data analysis portion. The participant recruitment process will be through several steps, first being identifying the target population, then seeking permission from the hospital's IRB or ethics committee, third being to create a recruitment flyer or email, four being distribution of the flyer to hospital staff through nursing huddles, notice boards, or discussion with nursing management and education department. Fifth being screening the participants based on the eligibility criteria and obtaining informed consent. Sixth being the research study not offering incentives, so reducing that bias. And then 7 being maintaining confidentiality by assigning unique identifiers to the participants. This will be through a semi-structured interview approach, which provides flexibility in capturing detailed narratives while also maintaining consistency among all participants. It will be 45 to 60 minutes in length and include open-ended questions with prompts to guide the participants through the interview. We will obtain consent to record audio prior to beginning, and we will also collect demographic information to identify patterns or trends in turnover intentions. As you can see here, this is the demographic information sheet that will be filled out. So here is the interview protocol. First, it starts with the title of the study, researcher name, date, participant ID, and location. It also includes the introduction, purpose of the study, confidentiality insurance, and recording and consent, and ensuring that we obtain written consent from each participant prior to starting. So these are the interview questions. They are broken up into 6 sections. First being background, second being experiences and challenges, third being support systems, fourth being job satisfaction and turnover intentions, fifth being suggestions for improvement, and sixth being closing. We will thank each participant for sharing their insights and experiences, and we will also ensure that each participant is able to reach the researcher to be exposed to the research findings and be a part of that dissemination process. So this is the data analysis approach, which will be thematic analysis for this study. The interviews will be recorded and transcribed. Then through the transcription, we will create general initial codes. Then we will group these similar codes into themes. We will refine and review these themes and name the final themes. Then we will write up each finding and link the themes to the research question that was posed. We will also use qualitative computer software programs, such as Deduce, to aid in sorting and storing of data, as well as coding so that patterns can also be identified. We will also ensure qualitative validity and reliability through investigator triangulation, which involves using multiple researchers to collect and analyze the data. This helps to reduce individual bias and brings diverse perspectives into analysis. We will also maintain audit trails, which will help with reliability. This will be done through detailed documentation of data collection, coding, analysis, and interpretation through field notes, memos, and coding schemes. We will also use reflective journaling to reflect on personal bias and assumptions so that findings are not influenced by researchers' personal beliefs. Finally, we will disseminate our research findings through poster presentations at nursing conferences, nurse manager workshops, internal hospital reports to hospital administration, nursing education, and staff leaders. We will also share our findings at staff meetings in the hospital and discuss them in team huddles or nursing council committees and teams. We will also share through nursing podcasts, YouTube videos, and TED Talks to reach more of a mainstream, broader audience. We will also use nursing schools to share our findings with future nurses. And finally, we will share our findings through local chapters of professional nursing associations, such as the ANA or Sigma Theta Tau Honor Society of Nursing. And these are the references that were used for the study. Thank you very much.